When you're having radiation, it's a computer-controlled process. You're put onto a bed, and there's a molded device that you sit in, and part of the preparation is creating that molded device. But they put you in a device that's molded to your body, so you have to remain absolutely still.
This podcast deals with prostate cancer, surgery, medication, and other medical topics. The host is a prostate cancer survivor who is recounting his experience with treatment. He is not a medical professional, and you should not use his commentary as medical advice. Please always consult a medical professional when learning about and understanding prostate cancer or any other disease.
Well, I hope you're having a great week, and I want to thank you for joining my podcast. I wanted to shoot this episode because I'm at a point in time in my own journey where, if you've been following my history, and hopefully you have, so you've been able to learn from a lot of my experiences, and hopefully your experience with prostate cancer can be as best as it can be given the circumstances. But I'm at a point where I am just shy of starting radiation treatment for a possible recurrence. And I'll talk just a little bit about that and then kind of where I am as of today. So my PSA was rising up gradually, slowly but gradually, and finally when it hit point 4, I decided with my doctors this would be a good time for radiation. I had my original surgery in 2015 and had many great years after that, minimal side effects, which I really relish, of course. But I'm at the point now, as many of you will be, where potentially there is a time where you will have to have a second round of treatment. The great thing about prostate cancer is it's one of the few fully curable cancers that we can have. And if this is the worst that ever happens to you or happens to me, given the circumstances, I'll take it. So before radiation therapy, you will go on an ADT. And I'm going to talk just a bit about that, just a little bit on the ADT, the androgen deprivation therapy. The experts agree that if you're going to have radiation for any type of prostate cancer related disease, whether it's the original prostate you're radiating or the prostate bed when you have a recurrence, that in order to have the best effect of the radiation that they're sending through you, the cells that are present, whether they're microscopic or more advanced, we want to tire them down and starve them to a point where they're very weak. And when they are very weak, they are much more susceptible to the radiation effects than if they're not. And this doesn't mean if you have radiation without a therapy like Lupron or Orgovyx, it doesn't mean it's not effective. And in many examples that they've seen, if you've got very low-grade cancer, they probably are effective. But having some kind of precursor to the radiation helps, improves the ability that the cancer will be eradicated. It's worthwhile. The Orgovyx, I am coming on to my 4th week of Orgovyx, and to my delight and to my surprise, the side effects are really, really minimal. And I know a lot of you that have had Lupron and similar therapies have had a lot of issues. The issues tend to be hot flashes, loss of libido, erectile dysfunction, bone loss, muscle loss, weight gain, etc., etc. And I don't know exactly why different people have different reactions. What I can tell you is that I decided from the outset when I was going to start taking Orgovyx, and Orgovyx is a pill form of ADT. Lupron is a shot in the arm. You get one shot, it lasts about 3 months, and then you'll get a second shot for a total of 6 months. In most cases, Orgovyx is just the pill you pop every day, and it takes effect quite immediately. With my Orgovyx treatment, it got to its maximum effect after about the 10th day, I think. But they say 4 to 5 days is when it really kicks in. But anyway, I get warm from time to time during the day. I'll feel my body getting a little warmer. When I'm sleeping at night and I'm under the covers, I'll feel warm that I have to kind of flick open the sheets. I'm not sweating. Is it really something that is bothersome? It's a little annoying, but I run hot as it is, so it's not like this is something that is unusual to me. But in terms of the other side effects, I definitely, in terms of libido, your libido level goes down, but for me at least, it hasn't disappeared. I am able to get aroused. I am able to have an erection. I am able to have an orgasm. It's a little trickier. It's not impossible. The way I would equate it is when you have full functionality and you're not suffering from erectile dysfunction, there are times where you're preoccupied with work or stress and sex, either via masturbation or with a partner. It's just a little more complicated because there's a lot of stuff on your mind. And I think, for my case at least, being on Orgovix, the effect is similar to being distracted. So if you really focus and really try to make it happen, then the sexual function is not different than it was prior to taking it. So far, it seems to be okay. I'm working out 3 days a week. I'm working out fiercely. I'm watching my diet, although I'm cheating 1 day a week. I'll have whatever I want, but I'm eating well, exercising, getting plenty of sleep, drinking a lot of fluids. And if that's the magic to getting through ADT, then so be it. So if any of you are going to start Lupron or Orgovix or similar treatment, try some of these rituals and you might find that they help you. But this particular podcast is about the steps preparing for radiation. And what happens is, if you've never had a radiation treatment before, it's a computer-controlled machine. And the two most common types of radiation that you'll receive for prostate cancer is IMRT, which stands for something modulated, something. I don't know what the acronym is. It escapes me at the moment. But IMRT is X-ray type radiation, what they call photon radiation. And the other type is proton radiation. I've spoken before about one versus the other. Proton is the approach that I'm taking. I was very fortunate that my health plan allowed me. It's a very expensive type of radiation. But regardless of how you get radiation, the preparation for it is to make sure that, well, let me back up a little bit. When you're having radiation, it's a computer-controlled process. You're put onto a bed, and there's a molded device that you sit in, and part of the preparation is creating that molded device. But they put you in a device that's molded to your body, so you have to remain absolutely still. And the radiation machine is kind of like a big moving arm that kind of moves around you. If you've ever had, it's not really like a CT or an MRI where you're surrounded by a tube. In a sense, you're lying on a bed and there's this machine that kind of comes over you. If you've ever been to the dentist where they kind of pull that, that X-ray thing in front of the side of your face, think of that, but 100 times the size and computer controlled. So it's something that moves around you and the computer is telling it where to lay the beam. So to create that ritual and to instruct and program the computer exactly what to do, where to aim, how much radiation, etc., they do a practice session, which they call a simulation. And in the simulation, you walk into a special room. You're not in the radiation machine. It's actually a CT machine. They lay you down. It kind of feels like you're laying on a beanbag. They put you in position where they want you to be when you're actually going to have radiation. And I think they suck out the air or something, but it molds around you and it hardens up. So it kind of creates a cast of your body in position where you won't move. So that's one of the things that they do. Then what they do is in that position, they feed your body through a CT scanner, and the CT scans are then fed into the computer, and then several doctors will do this. They will then, in a 3D fashion, look through the CT, really understand where everything lies in your body, because in my case, my prostate is not there anymore. So it's a prostate bed that's connected to my stomach. And, when they remove your prostate, they reattach your urethra to your stomach. Then there's the rectal canal, which is all there. So they really try to figure out where everything is in 3D, and that way they can aim the radiation. An important part of this setup is when you have your radiation, you want to ensure, or they want to ensure, you're not really doing anything, they're doing everything. But basically, they want to make sure that you are only radiating the necessary area. So you've got your rectum on one side, you've got your gut on the other side, your stomach, and that's all connected. So what they want to do is they want your bladder, I shouldn't say your stomach, it's your bladder. They want your bladder full, and they want your rectum empty. And so they do this in a couple different ways. So for your bladder, obviously you fill up. So what they do is they will ask you, before even starting the molding of everything, you will pee out everything you can, and then they will give you 32 ounces of water to drink. and then they lay you down, and then they, using an ultrasonic device, like when they check for babies, they will look into your bladder to see how full it is, and they want it to be quite full. And I think in my case, they said 150 milliliters, I guess, if I got that right. Anyway, it was a certain full amount, and then you lay there until you're full. And you have to have some control. You feel like at that point, it's not like you're desperate to pee, but you definitely feel that it's full. The second part of that, and this is the part that is maybe a little different for everybody, and I want to talk about it, is how to protect your rectum during radiation. So I don't have a fancy diagram, but you've got your bladder, which is really attached to the prostate bed, and right next to that is the rectum. And I'm not talking about your bowel. Your bowel is where your fecal material kind of builds up. Your rectum is where it exits the body. And in many cases, for a lot of us, the rectal canal, it's never clear. There's always material in there ready to escape. I think we all know that. Not something we really want to picture, but they want that rectal area to be not only empty as possible, because when it's full of material, it pushes into the prostate bed area. The way to protect your rectum as best as possible, you're going to hear about something called an OAR, or kind of a gel insert. This is something that they use when you're having radiation on your prostate. And it's a little insert that goes between the prostate and your rectum, and it stays in there until radiation is done. So it'll be done in a doctor's office. They'll insert it there, and it creates a barrier. Just to back up, when you're radiating the body, where your prostate is, and in my case, where the prostate is in the prostate bed, you've got bladder, prostate bed, rectum, all in the same area. You don't want to radiate the bladder. You don't want to radiate the rectum, although they will receive radiation because they're in the area. So the best way to avoid that is to protect the area. So when you don't have a prostate anymore, there's no OR spacer to put in because the rectum sits right at the prostate bed. So what they do instead, now this is the tricky part because not every doctor does this, and every doctor should do this, is they should insert a special balloon into the rectum, which they fill up with water. And what it does is it creates a barrier so that the radiation, as it comes through the radiation bed, it'll hit one side of the rectum, but it will not go through the rectum and out the other side because the barrier protects it. And this is the single most important way of ensuring as much protection for the rectum as possible. The problem is you're going to come across a lot of radiation oncologists who will not use a balloon. And usually when they don't use a balloon, now this is my belief because leading up to my decision to have radiation, I met with several facilities, several radiation oncologists. There was one in particular who admitted to me, because I asked him, I said, why don't you use a balloon to protect the rectum? And he said, well, and this is part of a hospital, mind you. This is a kind of a cancer ward of a hospital where they do radiation. And he said, well, in order for us to do the balloon with each treatment, remember, if you're doing 39 treatments on 39 days, somebody's going to insert a balloon in your rectum and they're going to fill it with water. And that's every time. I just don't think they want to do it. In this particular case, he said, well, we don't really have nurses available that will do that, so we just don't do it. And that was a real red flag for me. So as it turns out, there are quite a few people who are getting radiation without the balloon. And once again, it doesn't mean you're going to have issues, but my goal in this whole process is to take every step possible, maybe even if it's overkill, just to make sure I maximize the ability to destroy cancer and to preserve my body. So the ADT, which some people question, I'm taking as a precaution. Do I really need Orgovix? Do I really need ADT? I believe I do. But maybe I don't. I have very low grade cancer and my recurrence is microscopic at this point. So in theory, I could radiate without it and be just fine, but I'm erring on the side of caution just in case I'm wrong, just in case the doctors are wrong. And same thing in protecting my rectum, when people do have after effects from radiation of this kind, there are sometimes bowel issues, but more often than not, there's rectal issues, rectal bleeding. There's a condition, I don't remember what it's called, but tissue builds up and it makes it harder to excrete fecal material, and there's a second surgery needed, blah, 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 etc. So we're all different. Our bodies will handle radiation a little differently. But if there are ways to mitigate that as much as possible, and the best way to mitigate any effects on the rectum is to have a balloon there. So there's a controlled sort of barrier during your radiation. So if any of you are about to get radiation and your doctor does not provide the balloon, listen, I'm not a doctor, but I would tell you, you must have it. And that's just my personal opinion. So getting back to the simulation, during the simulation, they simulate everything. They simulate the rectal balloon. They simulate filling your bladder with water. They put you in that casted material, and they run you through the CT machine in that position so the computer can get a proper image of everything, including the rectal balloon. So what is the rectal balloon like? What does it feel like? It's really, this is where you get into a very personal relationship with your technicians. My technicians were 3 lovely young ladies. And like I said, this is a very intrusive part of the setup, but they make it very comfortable for you. The way that they do it is you lie on your back, you put up your knees. You've seen the position when a woman's having a baby. Well, your knees are up in that position, and they get down there, and it's lubricated. It doesn't hurt. It's always a little awkward. For those of you that have had the doctor's finger inserted, that moment is that little kind of moment of discomfort. Once again, it's not uncomfortable. I think it's more just we're thinking too much about there being something inserted into the rectum. Anything done medically for medical reasons is A-okay by me. Just like the catheter. I had to self-catheter once during my original bout with prostate cancer, which I vowed I would never do. But when you have to do it, you do it, and that's fine. But please see if they can do a rectal balloon for you. It's not that big of a deal. Listen, it feels kind of good. They fill it with warm water. It is what it is. So anyway, so you're in that position. So what happens then is they do the CT, like I said, and then the doctors get together and they make the plan. So I'm filming this on May 10th. My radiation starts on June 3rd, and I'm going to update probably every other week or whenever it's necessary, I think, to relay some information. But I wanted to make this podcast for any of you that are approaching radiation and kind of wanted some understanding of what to expect. It's really not that big of a deal. And even the radiation itself, I had radiation last year. For some of you who recall, I had 5 days, same facility, same type of equipment, proton equipment. The radiation is no big deal, but the mindset is very key. You absolutely have to have the right mindset for a proper outcome. I think part of the reason maybe my dosing with Orgovix, that ADT, is going so well is because in my mind, I've basically convinced myself this is how we get rid of cancer the second time around for good. And this is necessary to allow my body, to be prepared. So I'm not grieving over it. I'm not complaining over it. If there are side effects, that the best thing you can do is really just always keep in mind the context. There's a reason we're doing this, and it should never be about why me, which is why we're doing this. We're doing this to combat this. This is a fight. This is a war between you and this disease. And same thing with the radiation, whether it's a balloon up your rectum or, sitting there with a bladder full while they do the radiation, all these things, you just kind of take it in stride and be happy about it. Try to be as positive as you can. We don't want to be the victim here. We don't want to sit there and wallow and wonder why. For those of you who have family and have loved ones around you, they really depend on you to get through this. And you've got an obligation and a duty to make sure you're there for them. And I don't want to undermine the seriousness of prostate cancer and these treatments, but I will say I consider myself quite lucky. If this is the only serious disease I'll have to deal with cancer-wise, compared to all these other things that I could have had, then I'll take it. You never know exactly what's going to come next. But as I keep repeating, I have my vision, I have mobility, I have taste, I have hearing, I have love in my family. I love someone. I have someone who loves me. These are all very important things to have. So it's really about the enjoyment of life and just really trying to overcome any of these obstacles that may come up. And I am going to, in a few weeks' time, I'm going to create a podcast that deals just with the idea of incontinence and erectile dysfunction, especially for those of you who have lost it during surgery or radiation and it hasn't come back. It's a really, really tough time for a lot of folks. And I want to try to just offer some words of wisdom as to really how to cope with it and deal with it. You know, I'm one to talk. I regained continence. I regained erectile function. It's possible during radiation, those will go away. So that is always a possible outcome. And, you know, I'm prepared for anything. But I think I do get a lot of notes from people who did not have a successful surgery. The cancer was removed, but they're left with these other issues, wearing diapers and not having an erection and et cetera. And it's kind of tough. But I want to, in that session, really spend time and just try to address it. Try to give you a way of thinking that will help that a little bit. And it's really about appreciating what we have. And you know, and it almost sounds like a sermon. And, you know, I'm not going to make this about religion. I'm not going to make this about anything other than yourself and your mind and the love within you and the love of people around you. And your own belief system will get you through what you need to get through. So that's kind of, as usual, a long podcast. I'm making these a little longer, so if you listen to them in your car, you have something to keep you entertained. Sometime maybe I'll have some music. You certainly don't want to hear me sing because that will be the end of my podcasting career. But for now, I just wanted to say thank you. Keep up the fight, guys. Keep tuning in. I'm always very happy to get comments, whether it's in YouTube or in Facebook. I try to answer as much as I can. Sometimes I get a little behind, but I do read every comment, and I'm always very, very grateful for the well wishes that all of you have been giving out. So, and I wanted to mention my birthday is May 28th. Now, I'm only saying that because I turned 60 on May 28th, and that's the big number. And I think 60 is the new 30, at least in the mindset. But it's a great day. May 28th is also the birth date of, for those of you that remember, back in the 50s, the Dion quintuplets. That was the first time we had famous quintuplets. That's who I share my birthday with, and I'm not sure anyone else notable. So there was a Canadian comedian, I forget the guy's name. Well, they were called Wayne and Schuster, if any Canadians are watching this, but either Wayne or Schuster also had a May 28th birthday, but that's it. So that and me. So that's it for now. Thank you guys again, and we'll talk to you very, very soon.